Hi there, happy Monday. It's Dr. Shiroko, and I'm the author of the book Healing When It Seems Impossible: 7 Keys to Defy the Odds, and the owner of Heart to Heart Medical Center. Happy Monday. So, today I want to talk about perimenopause and what happens around perimenopause that causes weight gain. Because many women come to my office complaining about that and talking about how their weight becomes more of a problem and they can't seem to get rid of it. And I remember when I was 40, somebody told me I was in perimenopause and I got so annoyed. but uh, it can start early, and in Chinese medicine it actually could start when you're as young as 35, and these days with so many chemicals in our environment it's possible that it could even start earlier. And it may not affect your periods at all. You may not notice that anything changes with your periods, and you might still have symptoms that go along with what's called perimenopause at in your early 40s or mid 40s, or even for some of us as late as mid 50s. So everybody's different, and things change depending on how your hormones are behaving, but also change based on whether there are toxins in your environment and things like that. So usually the first thing that I suggest, especially if you're a younger woman who is experiencing perimenopausal symptoms, I talk about the liver. In Chinese medicine, the liver regulates the smooth flow of energy in your whole body, the ability to detoxify, which is actually Western medicine, and it affects your menstrual cycles. So if you start having symptoms of like irritability with your periods, or PMS, or severe cramps, or bloating and gas more just before your period, or trouble sleeping just before your period, these are all symptoms that could go along with PMS or perimenopause, and they're connected to changes in your hormone levels that occur, you know, before your period occurs. And the time so your natural cycles begin, at the, let's say, day one of your period. Slowly the estrogen level rises until it peaks at the time of ovulation. And then slowly it goes down until it becomes its lowest right before your period starts. Progesterone starts to climb at ovulation and peaks shortly after ovulation, and also goes down right before your period. So when you have PMS symptoms, usually the most sensitive time of the month is right before your period, because that's when your hormones are already at their natural lowest. And so if your hormones are sort of gradually going down, you might have more symptoms right before your period, because that's the time when they're slightly lower than they would naturally be. And if they're already kind of lower, then you'll notice more symptoms right before your period. So the first sign is actually that you might have PMS, or more irritability, or more difficulty feeling okay right before your period, or right at the beginning of your period. And in Chinese medicine, that's all regulated by the liver. And so one of the first things I propose is that you use a detox. I have a 2 week detox that I offer called a seasonal reboot, that you can do once or twice a year to help detoxify your liver and to help your liver do its job better. That helps balance your hormones and stabilize your system. And it doesn't have you don't have to do anything to sort of uh, take extra hormones or anything like that. And then the second thing is that around perimenopause, we become more sensitive to blood sugar. So this is called insulin resistance. And so there are certain things, there's all kinds of things that we can do. And I'm just going to talk about a few today. But you become more sensitive to blood sugar issues. And so carbohydrates, simple carbohydrates, and processed foods and sugars are more likely to affect us when we're in that perimenopausal phase. So eating, a muffin for breakfast, or toast for breakfast, or even oatmeal for breakfast, at breakfast, the carbohydrates have the most impact. And so, what's best to do actually for a perimenopausal time is to have a high protein breakfast where you have about 30 grams of carbohydrates and usually within an hour of getting up. And the reason this is helpful is because a high protein breakfast actually lowers your cortisol level over time. And cortisol is one of the things, it's our stress hormone, and it can be one of the reasons that we begin to gain weight as we are in perimenopause. So, what happens is that our other hormones start to decline, and for some reason, cortisol levels might go up for some women. And cortisol, again, is the stress hormone, so it helps us deal with stress and manage complex situations. It's the reason that a lot of us get belly fat, and it's the reason that you might have trouble sleeping because your cortisol levels could be high at night. There are many natural ways to lower your cortisol, but one of them is to have a high protein breakfast within 1 hour of getting up. Now, there's a lot of talk about intermittent fasting as a way to help, one, lose weight, and two, balance blood sugar, and three, help manage hormones. And so I want to tell you what I think about using intermittent fasting, because a lot of people do the intermittent fasting from like dinner time until lunchtime. So you skip breakfast and you don't have lunch. In actuality, from my experience of working with thousands of women, what I've noticed is that if you have an early dinner and then do your fasting from, let's say, 5 p.m. or 6 p.m. until the following morning at like 8 a.m., then you have the long fasting window, which helps balance blood sugar, but also you get up in the morning and you have a high protein breakfast, which helps regulate your cortisol levels. And that helps with a weight loss and be anxiety and stress and sleep and all kinds of things. So that's what I recommend in terms of using intermittent fasting. And then one other thing that's really valuable. So the things that I'm mentioning here are one, having a high protein breakfast, and the intermittent fasting window being from earlier in the evening to the following morning rather than later in the evening till lunchtime. And then the second and the third thing is the exercise pattern. So a lot of women, and myself included when I was in my 40s, they exercise hard and they believe that cardio is the best way to lose weight. And when I actually figured this out when I injured my knee in my 40s, I had an injury to my right knee and I had to stop exercising so hard because I kept hurting it. And when I slowed down the level of exercise, I actually began to lose weight. So one of the things about weight loss that's valuable is to not over exercise, because when you over exercise and you push your body too hard, you actually again raise your cortisol levels, and then that causes your body to hold on to weight, and it might even cause that belly, that what we call muffin top. So it has almost, maybe you might not hardly eat anything and you might have trouble losing weight because you're exercising too hard. So there has been some science about what's called HIIT training, which is high intensity interval training. And the idea is to do something that pushes your heart rate up to a high level for a minute and a half or a minute, and then to sort of rest for a few minutes, and then another level of intensity for a minute, and then to do that in bursts of activity. And when you do that, when you allow that intermittent resting time, so it's the rest time that's important. Again, it lowers your cortisol level, and that allows you to get the benefit of the exercise without overstressing your body. There was one other thing I wanted to tell you about, and I'm trying to remember what it was. Well, at the moment, I can't think of it, so I will, if I remember, I will put it in my post post notes so that you can get it. Thank you so much. Have a wonderful day.